can go ahead and get started. So welcome to our second Early Learning Council Data Steering Committee meeting. And I thought there's a couple new faces that weren't able to join last time, and we have some presenters here. So why don't we go ahead and get started. So I'm Dana Harganani. I serve as a Child Health Director for the Oregon Health Authority and work very closely with the Early Learning Division and sit on the Early Learning Council. So I co-chair this committee.
Yeah, I'm Rob Saxton. I'm the Deputy Superintendent at the Department of Education.
I'm Angela Long with Department of Human Services, Office of Business Intelligence.
I'm Lisa Parker. I'm with Oregon Health Authority in the Office of Health IT.
We'll come back to them.
Okay. Hi, I'm Bobby Weber, Oregon State University, and I do research in early childhood and have worked with a lot of the data systems and the Oregon administrative data. We do a lot of administrative data research, and so I'm familiar with data for early.
I know that Carolyn Lawson is unable to be here today. I think there was someone who was going to be joining. Why don't you please come join us up here?
Okay.
Yeah, sorry, I didn't get all the names switched over, but please do join us.
So I'm Carol Weinmore. I am a Senior Project Manager at the Oregon Health Authority, and I am here just to kind of listen in because I'm not normally here.
Okay, thanks for being here. I appreciate it. All right, down at this end.
Hi, my name is Teshin Abdullah. I'm actually from Arana Consulting. We're working with the Early Learning Division to set up the hub data system.
Great.
My name is Abhijit Parakar. You guys can call me AV. I'm with Arana Consulting, also working closely with Megan and the Early Learning Council.
And we'll be hearing from them in a little bit.
Yes.
And I'm Doug Costi. I was absent last time. My apologies. My son got married. And I'm an assistant superintendent for the Office of Learning in the Department of Education.
Congratulations and welcome.
Yeah.
I'm Megan Irwin. I'm with the Early Learning Division, and my focus right now is launching and supporting the Early Learning Hubs. And it's about to get real, which you will learn about later.
I'm Lynn Saxton. I'm a member of the Early Learning Council, and I'm the Executive Director of Youth Villages Oregon, and we are a data-driven organization serving 11 states in the country.
Hi, I'm Dawn Woods, and I'm with the Early Learning Division, and I'm the Quality Improvement Manager for the division, and really work a lot on the Race to the Top and the Quality Improvement Plan, or Quality Rating Improvement System.
I'm Nancy Johnson-Dorn, and I work at Oregon Department of Education, and I am a director of our special education programs for early childhood, and then also work on a Race to the Top grant and other early childhood to K-3 programs.
I'm Darren Wellington, and I'm here today sitting in for Cy Smith from the Department of Administrative Services State Chief Information Office. Hopefully I can give you the level of support that you've come to know and love from Cy.
Peter, back to you.
I'm sorry.
We're just doing some brief introductions right now.
Peter Tromba, I'm the Technology Director for the Eugene School District, and I'm on loan this year to the OEIB to work on a business case for the state longitudinal data system. And I apologize for being late. Just to let you know just how sensitive data is, the reason I was called out was because a mistake in a school office with a box not being checked on a student information system led to an estranged parent knowing where kids are that had been taken out of the house by DHS, and it's an emergency in my district, and I just had to tell them over the phone how to turn off that option. So as we talk about sharing data, this is one of the things that comes up often is we make it more available. We have to make sure we put in all kinds of safeguards, and even if you put in every safeguard in the world, if one box doesn't get checked, you get an emergency phone call. So,
thanks for being here. John?
I'm Jada Ripley. I'm the Early Learning System Director.
And do I hear someone on the phone with us?
I did.
Yeah.
he might be muted and not realize it.
Yeah.
We should make sure we're not muted. Anybody on the phone?
Hi, this is David Mandel. I'm just listening in on today's meeting.
Oh, great. Hi, David. Welcome.
And this is Hillary Saracino, and I'm just listening in as well.
Great. Welcome. We have so few people here today. Some of them are presenters. Do you want to just go ahead and introduce yourselves?
I'm Kate Wilcox, the Maternal and Child Health Manager in State Public Health.
And I'm Catherine Broderick, and I'm also in Maternal and Child Health, and I'm the Manager of Assessment, Evaluation, and Informatics.
In the back.
I'm with Person Department of Administrative Services, Chief Financial Office, and I'm assigned to Basic Health and Learning.
Brian DeForest, I'm the interim state CIO, here to learn as much as Darren is, but also I have had previous involvement with Early Learning Council.
Les McCormick, the Child Care Project Manager for the portfolio.
Welcome, everybody. So I just wanted to do a brief review of the agenda and see if there's any additions or comments that you guys want to share before we get going. I think for me it's an exciting agenda because we had our first meeting last time and still trying to figure out kind of the role and how the steering committee will work. And I think this agenda really highlights some of the opportunities ahead and the work we'll be doing. So we're going to start by getting a follow-up from the home visiting data system discussion from our last meeting. And it may be a very brief conversation, but want to make sure we hear about updates and timeline ahead. We're going to then hear a little bit about data needs on our quality rating and improvement system, which is focused in our early learning division on childcare. So Don will be sharing an update and looking for feedback on next steps for that area. We'll see how that timeline goes. Oh, Christy, I'm sorry. 1 second. We'll find a break depending on how quickly the agenda goes. We're then going to have Megan Navajit and his team here give an update on the data needs and plans around the hubs moving forward. And then we're going to come back to ground to listen to hear an update from Peter on the evolving work to put together the business case on the data system for the statewide longitudinal system. So I think this will be a really broad topics, but I think it will be great to kind of go that full circle with the group. Any questions or additions that we missed? I also wanted to say I think we're going to probably plan to start getting regular meetings on. It's been a couple months, well, more than a couple months since we met before, but the discussion topics and needs are probably going to become more frequent, and so I'm looking at every other month meetings and to plan those well in advance so we're not looking for dates at the last minute. So you'll hear more about that at the end of our meeting, but that's kind of where we're going to be going from here. Rob, do you have anything to add to that?
No, not at all. It's exciting to know that there's actual work underway. So
yeah.
It's great.
So Catherine and Kate, do you want to come join us?
So, hi everyone. I've presented to the full council a couple of times, and this time I just get to sit back and play a supporting role because the majority of the work is happening out of Catherine's unit within our section. So I'm just going to turn it over to her and be a supporting person.
Anybody on the phone, if you could just mute your phones, we're hearing a lot of feedback on our end. Thank you.
Well, I know many of you were here at your last meeting where you heard about the plans for the home visiting data system, and I'm just really going to give you the briefest of updates on the status. We have, as you know, an aggressive timeline, and it's now even more aggressive than it was when I spoke to you at the last meeting, because, as you may remember, this project needs to be in place and the funds expended from our federal maternal, infant, and early childhood home visiting grant.
Oh, no. Okay.
Okay.
So if you could, we're hearing you on the phone right now. If you could mute your phone, that'd be great. Thank you.
So we have a deadline of September 30th, 2014 to spend the maternal, infant, and early childhood home visiting, MIGV, funds for the data system. So that puts us in, as I said, a very aggressive timeline. We're working closely now with DAS. It's gone through our own DHS OHA Office of Information Services approval, and has moved on to DAS, and they have been extremely helpful and are working with us to expedite this because, again, as there have been challenges around just decisions of how to move forward with this project, that's compressed the time that we have to actually implement the data system. And again, we're purchasing a commercial off-the-shelf software application, but it does need to be customized, users need to be trained, it needs to be tested, and it needs to be rolled out and evaluated. So that's really where we are at. I'd be glad to answer any questions that you have or give you more specifics. Yes?
I'm Doug Costi, Education. And I apologize I wasn't here last time, and I tried to play a little catch-up by reading some of the materials, but as I was reading them, a couple thoughts came to mind. It looked like there was going to be a phased approach, and I was wondering if that means kind of like a pilot, or you're not anticipating all stakeholders to roll this thing out.
Right. Good question. The clarification is that the pilot will be in the 8 sites that have maternal, infant, and early childhood home visiting grants. So those are 8 sites around the state, and in those 8 sites, in some cases, multiple models are being implemented for home visiting, and in some cases just one. But the 3 models that will be incorporated, so 8 sites, 3 evidence-based models, which are Healthy Families Oregon, Early Head Start, and Nurse Family Partnership.
And what was the third one? I'm sorry.
Nurse Family Partnership. So part of what the pilot will be testing is the ability to have an integrated data system across multiple models. But ultimately, the objective would be to roll it out to all home visiting programs beyond those 3 models and beyond those 8 sites.
So this leads me to my second of 3 questions, which is data standards are typically an issue, and I noticed that in your report that you've got to come to some agreement on the data standards. Will those 8 sites across those 3 different models be required to use a common set of data definitions?
Yes.
Okay. And then my third question is really about sustainability in the project team. What's that look like once the federal funds go away? Is there ongoing funding for this project?
The staff funding is not really from the McV grant.
Okay.
Our staff. The funds for the data system that are a part of the grant are for the vendor contract.
Okay.
We do have, now let me take that back, in the grant that just began and runs for 3 years, we do have some part-time positions to help train folks in the sites, in the home visiting sites, among the providers, and we also have a part-time position for sort of technical assistance on our staff. But again, that's a limited duration position that's a part of the grant.
Well, then that leads to the next question. Nothing maintains itself by itself.
Right.
So what is the home visiting programs are all over the state, and as the rest of them come in, what is the plan for integrating everybody into this data system, and who will be maintaining it?
Do you remember that?
Sure, go ahead.
So what this is also meant to do is to replace existing data systems that each of the programs are already using. So the idea that came out of the steering committee, which is the guidance, the governance group that's overseeing this work, is that if all goes well in the pilots, that then we would retire some of those other data systems, and the funds that are used to support those would go towards supporting this one. So,
And an example is that on average, each of these providers enters data into 5 different systems. In almost all those cases, there's much redundant data entered in a different way, in a different system. And for instance, we in our office maintain one of those systems, which is called Orchids, not to be confused with Orchids. It's Orchids the flower. And that system would be retired if this system were expanded to cover all of home visiting, and the cost savings would be substantial if that were the case.
So I just want to take a second. I think hearing these questions, I probably could have done a little better at framing this conversation, particularly for those people that weren't here last time. We spent a great deal of time talking about this in detail at the last meeting. And so, as you've heard described, the home visiting data system plans have been funded and described through the McV grant, which is a federal grant that was submitted. I mean, we're into the extended year, so it was 3.5 years ago.
Well, there's multiple grants,
Right.
but this one that's
This one.
funding this has been 2 years.
Okay.
So.
And the reason that this conversation landed at this steering committee was the issue of home visiting crosses very strongly both the whole health infrastructure and the early learning infrastructure. And as you heard, the 3 models of home visiting that are funded out of the McV grant are education home visiting models, or early Head Start, as well as nurse home visiting models as an example. And so we felt like having these conversations in isolation around data systems and needs, rather having the steering committee who crosses over multiple agencies to think about this, support its moving forward, which was basically the discussion we had last time, or the conclusion at our first steering committee meeting. And so today the intent was to come back. The process last time was the proposal was moving from Oregon Health Authority to DAS, which is where that conversation stands right now. So that's a status update really today, but we didn't do due diligence to update everybody who wasn't here previously to know the background. We are happy to get you all the background materials, but I think the plan today was to really give an update. There's still more work to be done to move this forward, and some challenges in terms of timeline that we heard.
Yeah, and I'd really kind of like to reiterate that. To say that we're on an aggressive timeline is really kind of an understatement. Again, because many of the coordination activities and so on take time, especially in an environment as fluid and sort of with some new initiatives as we have here in early learning and in health simultaneously. The actual project timeline, or the time to implement the project, has been compressed to about a quarter of what it originally was envisioned to be. And so I think it's important that folks understand that we are moving full steam ahead, and it's going to be a challenge even then to get it done by the deadline. Doing it isn't the challenge. It's the federal grant deadline of September 30th. And so, as my friends at DAS pointed out to me today, that if you compress the timeline, you either need to expand the amount of resources you put in, or you have to scale back the project or the quality of the project. So none of those are really appealing prospects, but we do realize that we have an extremely compressed timeline at this point.
So one of the third options when you have those parameters would be to recruit volunteer support and oversight and kind of, I mean, one of the things that's troubling about the healthcare rollout that people keep saying is there's all these people on NPR constantly saying, well, I would have done this, or and I'm sure that just drives people who are developing the system crazy. But I do think we do have resources to draw on if you wanted an advisory council or some group of folks that do this work as part of their daily work that would be willing to volunteer their time to help, if that would be helpful. Sometimes that is like the last thing you need and more trouble than it's worth. But certainly if we do need that for some of the other early learning timelines that we're on to be sure that we, get this done, I'm happy to garner those resources from other sectors to help in an advisory as helpful basis, not to armchair quarterback or Monday morning quarterback or whatever, but to genuinely help.
That is a great offer, and we should think about how we could tap into those resources.
Thank you.
So along that same lines, thank you, Brenda. That was really thoughtful. Is there anything that anybody here can be doing to help you all as you try to speed this process along, or are there any parts where it's hung up someplace, or that people could, exert some soft pressure to make it go faster?
Well, I don't think there's a clear single hurdle. It's just there's a great deal of work to do that really couldn't be begun until we had a clear green light to go ahead with the project. And so it's just a very, very compressed time frame. Now, if Darren has any thoughts about how we could tap into some other things, because Darren's been working with us on the DAS.
This morning, I guess,
Yeah.
we met and we talked about, didn't know anyone who could volunteer resources, which is always nice to hear, but we talked about alternative methods of getting people in, such as a managed service provider contract, where you can target specific types of skills and do deliverables-based contracts on an as-needed basis to get some of the short-term tasks accomplished that you need to get accomplished before you can move forward. Resourcing is always a difficult issue. You either can borrow resources, or you can get position authority to have resources, or you got to buy them. You got to pay for them and bring them in. So we kind of have touched on that, getting more resources.
And again, the borrowing resources or garnering volunteer resources might be, really helpful. The challenge with the buying the resources is, of course, we have constraints in our grant, which is already, it's very ambitious to do what we're trying to do on the budget that we're trying to do. We're thinking that this is very exciting work, and we've had a lot of interest expressed by software vendors that are interested in working on this. I think certainly not for the dollars that we have to contract, but because this is, as you all really appreciate, sort of a pilot of some kinds of functionality that we're interested in looking at across agencies. So I think we maybe have some interest there, but again, our grant resources, looking at Kate here, are very constrained, and the funds that we do have for it are earmarked solely for the contractor. So we do have to beg, borrow, or steal any additional resources.
I think that one of the things we talked about today is a short-term plan of the activities and the things that need to occur for the project to move forward, such as releasing an RFP, request for proposal, that kind of thing. And I think once our office has worked with the project team a little bit, and we'll have a short-term list of activities to do, I think they'll be in a better position to say, I would like to, help, I need this kind of resource for this kind of time to do this kind of thing. I think they'll be in a better position within the next week or so to be able to tap people and take advantage of offers for help.
I have a question. Is there any ongoing, I know you had done a lot of work previously with your teams of stakeholders and users around data, your data champions group. Is that ongoing? Is that pretty much teed up and ready to go as soon as these hurdles?
It's sort of both. The bulk of the work, we have data champions, much better than a data subcommittee, data champions group for each of the three models, the Healthy Families Oregon, Early Head Start, and Nurse Family Partnership. So those are providers who have come together to help us fully understand their requirements. And some of that work's been going on really for 2 years. So the bulk of that work has been done because it needed to be done in order to draft the RFP, to do the business case, to develop the requirements for the system as a whole. We are still refining that and doing some of the work that kind of you were alluding to, which one of our informaticists, Dina Dickerson, would say is harmonizing the data, making sure that those data elements are lined up, basically, so that we can have an integrated system. So that some of that is still continuing. We originally had envisioned that much of that would be done by the vendor, but again, because our time frame is so compressed, we've just moved ahead and are doing large pieces of that were originally to be done by the vendor.
Any other questions, comments, input? So I anticipate we will invite you. I mean, the conversation at our last meeting when we heard this discussion was that this group would serve as a steering committee to this work. And so we will have you back at our next meeting and see kind of where things land, and hopefully be at a stage where we can be more helpful in an ongoing steering role to help support the work going forward.
And we would hope that if it's in 2 months, we would at that point be looking at vendors, be in the selection process. And that might be somewhere where some volunteers might be helpful, is on the selection committee.
Thank you so much. All right, Dawn, do you want to join us?
Sure.
Walk us through. So there are several documents.
Do you want me to move up here?
You can, whatever is more comfortable. This is fine. Okay. Did we get all your documents?
I think you guys did. Thank you.
Are there more?
Thank you, sir. There should be actually 2 documents that I'll be referencing. One is a picture like this, and the other one is, I'm not sure. Thank you. It says Department of there's an objective. It looks like this. It says quality rating information electronic application process. I have some copies if you don't have one in your packet. Anybody find those 2 docs? Okay.
And Don, just make sure to give a good overview of QIS, because many people might not understand.
All right, I shall try. I did have notes, so I could try to be succinct. So part of the Race to the Top Early Learning Challenge grant actually has 9 projects that frame up and make up the grant. And a core piece of it is developing a quality rating improvement system, which is essentially a tool for states to utilize in order to really work on the quality of care and education for young children. It really started within the child care realm of having what is a set of common standards, what are those workforce, program, and child outcome standards that we want to have, that we're all kind of working towards in a common method and systems, and it builds in those supports and incentives for programs to help achieve those standards of quality. And so, as we know, with any kind of quality system, to have data in order to make decisions around, to understand the environments where children are at, that the data system is a whole project within the Race to the Top, which actually really has 2 elements. The first core of it is to create a QRIS e-portfolio system. Oregon's QRIS system is really based on kind of a blend of data from other data systems, as well as providing evidence of meeting standards and some direct observation. It really builds on that foundation of state child care licensing and goes from there. And so the additional element within the Race to the Top data system is also to think about how do we look at the state longitudinal data system, and how do we think about it in terms of connecting to where children are. And so the e-portfolio system is really a way to understand where children are in the state, as well as we move forward and think about how that connects. This conceptual kind of picture here is really just that, but I thought it might try to kind of highlight how we think about the e-portfolio connecting with other data systems and hooking together. And so that essentially, it's twofold. We need a way for programs versus a big binder to provide us the evidence. We need a data system to increase that participation for programs, for them to be able to input their data, continue down that in a continuous quality improvement type of path. And those need to connect to some other data systems that we have. One being the licensing data system, which is the child care, I think it says information on your chart, but it should be regulatory information system. That's CRIS, we refer to it. And so that's what in the state we use to regulate early learning programs that are licensed. The Oregon Registry Online, the Oregon Online Registry is a workforce data system that sits at Portland State University. And that captures all of the workforce in early learning that are licensed in the state, and additional, it's really created for any early learning teacher, educator to participate and be a part of. And right now, our regulatory data system and the workforce data system, they talk through a central repository to feed into licensing, to show that they've met their ongoing training requirements. So for the first time, and actually Bobby's playing with the data now, we're able to really look at about 18,000 people roughly in the field who are working with young kids to really start to understand that workforce. So when you add the additional element of the QRIS ePortfolio, is it's building on those other, and there's a relationship. They need to talk back and forth and connect with those quality standards around the workforce, the child side, as well as the program standards. Ultimately, as it moves forward, we also look at how that information needs to feed into the early learning hubs, and what the QRIS is a metric within the hubs that they are to target, so that aggregate information we need as that connects, as well as how that hooks into Alder. And as we start looking at that child level as far as where understanding the demographics and the programs of which children are. I mean, those are down the line where it goes, but in order to have those hooks and those common identifiers to be able to understand the setting for which children are at. So that's kind of the key work and the big picture that falls into the Race to the Top data system work. We are currently field testing the QRIS in the state. We started in 8 counties and are expanding the field test to statewide the first part of 14. Another project within Race to the Top is a validation study. And that is really looking at, the first study one is really looking at, are our standards right? Are they differentiating levels of quality? So essentially, is a 3-star different from a 4-star, is different from a 5-star? The second half of the grant is really a second study that is looking at child outcomes. And so is children in 3-star facilities, how are they doing compared to children in 5-star? And so starting to look at, can we have higher quality or better child outcomes at higher quality levels? And so we felt we were really moving down the path, capturing requirements, looking at what needs to be done with the ePortfolio for the QRIS, and really, as you start down these paths, you start to think, and we determined we still have a lot of work to capture all the requirements and all the pieces that we would need to have in a ePortfolio system, and really felt we wanted to wait until the validation study was complete in order to really know where those standards are going to fall in building the system. So in the meantime, we are looking at building in an electronic application. And so currently, because it is a field test, there is a database that is capturing all of the pieces of data elements that are in these portfolios, which is a lot of work for data entry. I mean, a lot for reviewing it. It's harder for programs to apply, and so we're wanting to kind of expand that existing database that is capturing the field test information and essentially add on a component of an electronic application for which programs would be able to come on, and essentially it's like a fillable PDF form that would fill into the existing field test database to not have the data entry, to have the ease of inputting information, all those, just make it easier for programs and the data integrity of information being submitted. And so with that, I think I'll kind of stop and ask if there's any questions. I know our hope is that we get some input after I clarify any questions you may have, as well as just kind of garner the support of the steering committee as far as, is this a good path to move forward on with this interim process until we get done with the validation study and learn more during this field test.
I've got a couple of questions. So and I'm going to be presenting on the statewide longitudinal, because because I know in researching this as an educator, the outcomes of early childhood interventions might not show up till way, way downstream, maybe even post-secondary.
Right.
So is it the intent that individual agencies or providers would be in the long term measured against that long-term outcome from students who've been part of their, so that's the big picture?
No,
or-
I mean, I'm actually
Okay.
going to ask Bobby, who is leading our validation studies, if she could share the child side of the validation study, because you're right, I mean, it can take years for us to see outcomes. So using the kindergarten readiness as part of the plan and some other kind of immediate measures to probably their more causal type findings. But Bobby, I'd definitely ask you to help me out here.
Well, in terms of the assumption is that you can look at how well children do and play it back to the quality of the program. There are multiple barriers. Number one, most of these providers are private nonprofit or small businesses or nonprofits. They receive no money from the state, so they don't have IDs on these children. The children we will get in the system early are early intervention and Head Start, early Head Start. And those children will be in the system with IDs, and there'll be the potential to link to characteristics of programs, because this will tell us quality-related characteristics. So that's one concern, is we have a barrier in the makeup of the providers. So it doesn't mean it won't happen. It just means there's more challenges than if these were publicly funded organizations and you simply write a rule
Right.
and say you
Have to.
will do this. That's one concern. I mean, a barrier. It's it can be overcome, but it'll take time. The second is the use of early care and education in the United States is the dosage ranges from 2 hours a week to 60 hours a week. And the characteristics of the children who come in vary widely. So any attempt to link the outcomes of the children to the characteristics of the program that doesn't take into account dosage and the characteristics of the child when they enter is not going to be accurate. So again, these can all be overcome. I think that's where we're headed, but it's not as easy in the
Right.
first 5 years as it is in programs that are publicly funded. Does
Yeah,
that
that's
answer-
perfect. Or kinder, where you know how long they're in the dosage, or in first grade.
So I've got a really stupid basic question. I'm sorry, I'm going to have to do this. But so the QRIS e-portfolio is basically a quality rating system for Oregon child care providers. Is that it, or is it something more than that? I'm assuming there's a survey in there, but we're just getting institutional level data back. We're not getting student level data back from the
Correct.
QRIS.
Correct.
Okay.
It is a facility level data system.
Okay. So it's not a confidential data system.
And I would say that, and it is primarily, it has been started within the child care arena.
Right.
But it's definitely, one of the tools of it is to get all early learning programs for young children on a common grid.
Okay.
So that includes Head Start. That includes any program that works with young children. This would be a place for all facilities, all about those settings to have some commonality.
So this diagram then indicates that you're going to pull some information based on some web-based survey, and then you're going to feed that information to Alder and to the hubs that we think would be useful. So we would actually harvest data from
Yeah.
QRIS. Okay.
Yeah.
Okay. Thank you.
So
When
I don't know if this is a question, and it may be answered in the hub portion, but I want to keep, based on Peter's question, I want to keep coming back to system design and what the system anticipates, because we want to be careful here that part of what you have is an early learning system that's being empowered in the midst of freeway access lines already being used, right? So, and wanting to take advantage of existing kind of avenues, but also make sure we get to the goal. So, and the goal is that the hubs can assess client level data to determine if investments being made are producing the needed results, other results, or totally missing the mark. And so there isn't an expectation that if there isn't, I'll put it in the positive, there is an expectation that within a reasonable time period, that information will be discernible. And when we were working with the data set, the data group before, which Dick Alexander was very heavily involved in, and we were really using Alder as our linchpin or as our frame. Part of what we're trying to do now is say, okay, there's QRIS, there's other systems, there's the state's longitudinal effort, which is being refreshed, renewed, restored. And what we need to envision is using the hubs as one of the ways to get to the problem Bobby outlined, which is you have a whole bunch of providers providing services. Each cannot design their own research system or data system or analysis. But we want to be clear that what we hope to find is within a short timeline, and I would say 5 years or less, that interventions are being made with existing investments that produce results that will dramatically change the trajectory we are currently on for the early learning sector. That if we find out 20 years from now that we're doing something or not doing something, that's probably too late in terms of successfully changing the trajectory. So there's a time dimension to this, and there's a client level outcome dimension to this. And we've graciously and generously given that huge challenge to the hubs to resolve.
Well, and I think what you'll see today, what we'll recommend today is a staged approach to get to that, because getting to client level outcomes across 3 state systems and about 20 programs that are currently serving kids in a variety of ways is a challenge that doesn't need to take 10 years, but is going to take longer than 6 months.
Yeah.
So we'll present later a proposal that kind of stair steps us into it while still moving us forward in a way that's significant and different than how we've coordinated services before. But I'm always glad to have Lynn say client level outcomes so everyone can hear it and remember that that's what we're driving for.
Right.
And I think I know, just to kind of respond as well, as when Meg and I talk about the data mart, which she's going to share, is that the QRIS, understanding where children are that's an intervention. And so making sure that we're able to feed that information to where children are and what those quality components are is part of understanding what those strategies are that are hopefully making a difference. Yep. Yeah.
Don, could you speak, as I think one of the things you had mentioned was this plan for the phased-in approach for QRIS. Could you maybe speak to, again, the initial plan right now and the timeline you perceive, or the difference between the initial phase and the later phase, and see if there's any feedback or any ideas or support that you can get here.
Absolutely. So like I said before, we're looking at timing the full system rolling out in conjunction once we have findings from the validation study. We didn't want to roll something out, then you have to turn around and make some changes to it. And so that one is really looking at a bigger, broader, robust system, capturing these elements that we have time to think about how those hook to all the necessary data systems, would be rolling out the first part of 2015. This initial electronic application that is really just an additional feature within the existing field test database, we would be looking to roll out March of 14 in order to provide that mechanism for programs to be able to essentially apply online to the quality rating improvement system. And so we've got some additional time frames on the document around how we would need to in order to meet that timeline, to work with procurement, looking at the contract and the creation of that electronic application. Would start amending contracts in November and December, design it in December and February, test it in February, and then go live in March of 14. The nice, I guess, complementary work that has happened is that because we've been going forward with the determining the requirements for the more robust e-portfolio system, is a lot of that defining work has been completed, so we're essentially able to extract from some of those system requirements about what are those just core pieces that need to be a part of the electronic submission. So we think that that's really going to be able to clearly define exactly what we need it to do. We already have the data system. We know the data elements. We have the shared data dictionary that looks at those elements. But it is, as McVie shared, they are aggressive timelines to move it to move forward. But that is our plan. So any thoughts on that, or we maybe haven't considered, need to consider?
Dawn, I just think it's important to note that we really do need to up our numbers for how many providers are applying for this in order to have sufficient sample size for our validation study. So there really is an urgency there for getting something easier underway. And then having that feed into kind of a more robust system, so to speak, for later on.
So that was a comment I was going to make, is success metrics, and it sounds like you just articulated one. What would success look like with this project? And you probably want to set a number of...
She has a whole grid. It's beautiful.
It's a grid. Actually, as part of the Race to the Top application is we had set targets. So by the end of 14, and we paired this with the validation study, so we need a certain N in kind of at each star level of the QRIS across each type of care. And so it actually equates to 240 programs that we need on the QRIS. And so that's why it's a really large-scale field test. And so looking at these solutions to really increase and make it easier for programs to apply and get rated.
So do you feel like you're going to get enough programs participating?
We have a whole strategy on that.
Oh, okay. Okay.
Well, I mean, that's part of the...
This is one of those strategies to ensure. I mean, it's just rolled out. Our participation as far as engagement and getting started, we have about 275 programs that have received the initial commitment to quality rating. It's getting them into those 3, 4, and 5 stars, and so we see this as a key strategy to do that next level of applying for those 3, 4, or 5-star levels, which is where we need. So initially, you can look at about 300 programs have participated in initial training, and I mean 275 of them have decided to move on and continue. So I think engagement and interest is high in the field. But you can imagine putting together a paper portfolio is rather laborious. And so looking at ways for us to really keep the integrity of what that evidence is and what those quality measures and standards are, but being able to review it, submit it, process the data more quickly in order to make sure that we do meet our numbers for Race to the Top.
I think that's so important when you're thinking about home-based providers who are very small business owners who are with the kids that they watch from 6 to 6 and don't have a ton of time to put into creating a bunch of paper to send to the state. To me, this seems like a really key part of your strategy to keep that motivation level high.
Definitely. We know they do it on the weekends and late at night.
And it also just allows for kind of more interactive submissions so that they can be tracking their progress, not just putting things away in a binder that they, at the end of the year, give away. Just having those small little indications of, yes, here I am on the dashboard, I think can be really motivating. And I don't know that we've completely worked out how technical assistants may or may not be able to see where folks are in that dashboard, but having coaches be able to kind of see where folks are on their progress can make a really big difference.
So in terms of helping them, is that something a graduate student could help them do? I mean, part of what I think we want to do in this process is, this is the Dick with Nell drumbeat, but you know, there's a lot of people out there who have to get credit to get their degrees, and I'm shameless in going around to universities and saying, how many graduate students you got, what are they doing, we got stuff for them to do. And so if we need to draw down, to me the notion of taking care of children from 6 to 6 and then sitting down and doing all this stuff is, you know, really impossible to imagine. So if we need to get, to keep your N high, if we need to get graduate students assigned to projects, they get credit, they do the work, help the providers, you know, we can leverage all those resources. The Early Learning Council alone has connections to all the universities in the state and the community colleges, et cetera. We're happy to do that, and we just need you to tee it up and ask us to do it, because that's a great graduate school statistical or data set design project, and we got thousands of kids doing that every day and all over Oregon, and we just ought to point them in the direction of this project.
Great.
So,
Thank you. We will look at and see what that might look like as far as how that would engage. Because right now, this child care resource and referral have quality improvement specialists acting as coaches in there. And we know just from our input that relationship, and so figuring out how to connect with, you know, broaden that scope. And I mean, sometimes it might just be helping input the data into, here I've gathered it, put it in for me.
Yep.
Yeah, that's great. Thank you. Any other input, thoughts? Does this make sense as far as support to move forward with this strategy?
So Doug, I have a question for you. Do you need more information on all of this and how this is looking and teeing up?
Yeah, but I don't need it right now.
Okay.
I can probably take it offline.
That's what I was going to say, is I'm going to suggest that there be further
the
conversation
details, 'cause I'm trying to get a picture in my mind what this system really does. I can do that offline.
I think the most confusing thing is what we're talking about is thousands of these small
That's what I'm
businesses and
envisioning.
nonprofit. There's
Yeah.
about 1,000 centers, and there's 3,500 really small family child care providers, and then it's getting close to 1,000 now, I think, of the slightly, still home-based, but slightly bigger. So we're talking about a universe that's really very different than public schools. I mean, these are located in neighborhoods, majority home-based, and even the centers are small. In Oregon, centers average about 55 children. So it's, the strategies have to match, they have to match the characteristics of whose quality are we trying to rate. That's whose quality we're trying to rate. And so the strategies have to fit what that kind of target can do.
I can see a direct correlation to the kindergarten assessment, for example. The results that come out of the assessment, something's going to go back to the hubs or to the communities, and they're going to say, this provider said, I provide this level of service, but, you know, if we look at the data, they may or may not provide the same level of service.
Yes.
And that's why
That's
why I'd
what I
like to do
clearly
this
see.
loop back, because this is not unrelated to many of the other things.
Yeah, that's what I thought.
So I just wanted to check with Lisa and Angela and Kara. You know, this has been very early learning and education focused conversation, but I think in my mind there's a lot of connections to the health system and human services. So I don't know if you had any thoughts about those connections or just kind of staying tuned with this. I mean, I can just share a couple for the QIS system, for example, to get to a 4-tier?
4-star?
4-star, sorry. Child care providers need to be engaged in developmental screening.
3-star, sorry, Dana.
3, okay.
3-star level.
And that's a big push and incentive metric on the CCO side. So how are we coordinating these efforts, and where does that data go from the child care provider? So that's a bit of a separate conversation than this one, but I think it's all interconnected in a lot of different ways as well. We talk about the potential for kindergarten readiness being a shared agenda across health human services, and so childcare, where our kids are for potentially so many hours of their early years, has a huge impact on their outcomes, both health and education. So I just want to, it's been a very focused, appropriately so right now, early learning and education, but as we can make, that's why we're having these conversations here, is to make those connections. I don't know if you have any additional thoughts. You don't need to, just wanted to call it out. Okay, thank you, Dawn.
Thank you.
We will invite you for updates. Let's move in this forward. Okay. Why don't we just take a 10-minute break so we can set up the next presentation. Before we do that, Krista snuck in on me and then I got distracted again. So Krista, could you want to introduce yourself since you weren't here before? Sorry, I missed you on the first round.
That's okay, that's okay. Krista Shively, I'm with the Early Learning Division, the Director of Policy and Programs.
And how many weeks it's been?
I think I'm in my 6th week.
Okay.
So my learning curve is like this.
Okay, so grab something to drink and we'll come back at 3:15 and move forward on our agenda. All right, I think we can go ahead and get started.
But that's just how it is.
So, all right, I am going to let our team at the table take this away.
Sure, thanks, Dana. So we're going to be talking to this group today about our proposal for how we start to move some data collection and data aggregation for the early learning hubs forward. And before I jump into our presentation, there's a few colleagues that I just want to say a really big thank you to, because they've been instrumental in helping us get to the point where we actually have an idea about the direction that we can go. And the first person I want to say thank you to is Krista Shively, who in her 6 weeks at the Early Learning Division has added tremendous support and rigor in our thinking about how to do this work. And a lot of the proposal that we'll speak to today is actually Krista's brainchild, so thank you. Doug, I want to say thank you to Mike Rebar in your shop, who has also been tremendously helpful and has been a big part of the conversation that we've been having, and we've been working together really nicely. And then on the DHS side, I've had some great conversations at the program level with colleagues in child welfare and self-sufficiency. And on the health side, Dana has been absolutely wonderful in helping us navigate the connection to the CCOs. So what we're bringing forward today is our best thinking right now about how to start this work, and it's really built on our thinking, but also the thinking of colleagues. So thank you all so much. So everybody, I think, knows what early learning hubs are. Oh, this is what we're going to cover. I'm going to just remind folks what early learning hubs are charged with doing and why data is so important to that. We'll talk about our objectives and what we're really trying to achieve through basically a phased approach to taking this challenge on. We have some discussion that we'd like to have with this group in terms of advice and the right next steps to take, and making sure that we're moving forward in a way that is practical and makes sense and sets us up to get where we want to be long term. And then we'll talk about next steps. So just to remind everybody what early learning hubs are, this is really the new system that we're creating for delivering early learning services locally and coordinating across sectors. These are the things that hubs are responsible for. I'm not going to read you the slide. The bullet that I think is important to this conversation is the one about accounting for outcomes collectively and cost effectively. Those outcomes have been set by the Early Learning Council, and at the highest level are kindergarten readiness, stable and attached families, and building a more coordinated and effective system. And we're measuring improvement against those outcomes by looking at some improvement metrics, a number of children that are in quality care per QRIS, increased performance on the domains that are measured by the kindergarten assessment, decreasing foster care placements and reducing foster care in a safe and equitable way. Those metrics are really 100% aligned with the metrics that DHS Child Welfare is using to the same goal. Increasing the number of children receiving developmental screens and the number of children who have a primary care home. Those are shared goals with CCOs. And then we get into the improvement metrics that present the trickiest data challenges, which we'll speak to. But all of the metrics around system coordination and decreasing administrative overhead and serving more children are extremely important to measuring the success of hubs and require the most kind of nuanced and thoughtful coordination across a variety of programs that serve children across what we call the early learning system, which is much bigger than the programs that the Early Learning Division program funds directly. So that's where you'll see us speak to a lot of work that we probably need to do to aggregate data from those programs to actually understand how many children are served across our system within the hub geographic boundaries, what the cost is, and understand if we're making progress on decreasing cost and overhead while increasing service level to at-risk kids. So as we dug deeper into each of these metrics, we really just had this moment where we realized how big the scope of what we're actually trying to do is, even within just this small piece of early learning hubs. But I can't say it enough. We're working to coordinate data across 3 state agencies that all have their own approach to how they manage data, and across at least 16 state-funded programs, just to look at the system and population level data, let alone our eventual need for child level data, which I'm going to let Peter speak to in his longitudinal data system conversation later. So our goal for the short term and the midterm is to make sure that hubs have the data that they need to start down a path of improvement and to start to demonstrate results at least at the population and system level, if not at the child level yet. Because at the same time as we're doing this work with hubs, there's a much bigger conversation that's happening about the early learning data system and a longitudinal data system, and we recognize that hubs are only one part of that bigger conversation, so we want to make sure that we're positioning them to be successful and also fold nicely into the long-term direction that our state's taking. So today we're going to share a proposed methodology with you that starts to get us there, and then look for your input on what the practical next steps are and anything that we might not be thinking about in the right way. There's a little bit of time urgency here for us to leave pretty clear about what we need to do next. What doesn't have time urgency that we've talked about in this meeting. But just so that folks are aware of the timeline, on November 12th, the Early Learning Council will have some conversation about which hubs it wants to award contracts to, and then once that decision is made, we'll notice intent to award, and we'll be off and rolling with our first batch of hubs. And we've got to be able to provide them with something in terms of meaningful and real baseline data that they can start to set improvement targets from. So with that, I'm going to turn it over to Abhijit, who will walk us through what we think the right path forward is, and then we look forward to some discussion and feedback from all of you.
Thank you, Megan. So like Megan said, this is the overall strategic direction and the vision is to be able to collect meaningful data from the hubs to see how effective we've been with the implementation of the hubs. And then in a incremental circular fashion, either refine strategy, refine our metrics, and refine funding to these hubs so that we are being more effective with what we are doing. And the whole crux of this is to collect the right data at the right time. So, with that being said, the number one key consideration is time. We have in our RFA to the hubs said that we have certain timelines that the hubs are going to need to meet, and we're going to need to meet to present this our effectiveness to the legislature. For example, December is when the hubs start collecting baseline data, and in January we have to present some sort of quantitative data to the legislatures. Some other things that we have not as much information that we'd like is what capabilities in terms of data processes and capabilities of these people is what the hubs bring to us. We are in the process of evaluating applications, so at this point we don't know what exact capabilities the hubs possess. The same thing goes with unified policies and procedures. Again, like Megan said, we're working across 3 large state agencies that, for the most part, speak the same language, but when it comes to specific data elements and data processing capabilities, there might be some nuances that we need to look deeper into. Potential need to integrate with the SLDS. Again, this is the ultimate vision. We want to track kids from early learning all the way through college. So taking this at an incremental step-by-step approach, the overall goal would be to integrate with the SLDS. And the metrics, right now we have 10 defined metrics. Do we need to adjust them, tweak them, refine them based on what we find coming out of the hubs is another key consideration. And keeping all of these things in mind, we have a conceptual framework for how we want to achieve these objectives. What we envision is a data mart type solution. And I might want to switch a couple of slides ahead, because the 10 metrics that we have.
So
Go ahead.
So I'm not sure who all's going to see this presentation. Maybe it's us or maybe it's some other folks, whatever. But the use of the word potential on key objectives or key considerations on potential need to integrate into SLDS. Is that truly potential need, or is it the absolute need, or is it, what's the right word there?
We probably think it's the absolute need, but are trying to be sensitive to, Abhijit and I aren't the people who should decide that policy for sure.
Okay.
But we're happy to change it.
I just needed to check because I figured that there might be some feedback from people on the use of the word potential.
Who are the people that are supposed to know that, answer that question? The Early Learning Council? So, that's us, right? But, I mean, I think it's mandatory. I don't think we have any choice. I think if we fail that, we failed.
So is that a decision that needs to be made officially at some point by the Early Learning Council, or is that?
I think also it's probably why Peter's sitting here as part of the business case for the bigger picture for the state system also.
But it does raise the governance issue, which Doug raised before. It's so often what stops data integration is nobody really clarifies who's going to make the call.
Right.
Right. Anyway, it just worried me because I mean, it certainly is. The use of that word caught my eye a lot, obviously, and I didn't know if that was to catch the eye of others, but if somebody didn't say something, I'm afraid that it might.
No, that's a great point, Rob. And to that, I will say that we've been working closely with Mike Rebar, because one of the things we're doing in parallel with our data gap analysis is coming up with requirements for this system, per se, and we're taking into account what Mike is trying to do on the SLDS side, specifically the Common Educational Data Standards. We're making sure that our requirements capture the need to relate to those standards, so that when it comes time to integrate with the SLDS, we're ready on this end.
The biggest barrier I see is getting all these kids an SSID, and at some point, I mean, these are all resolvable, but that's not going to happen overnight.
Sure.
It took us how long to get the early intervention Head Start kids SSIDs. Now we're talking about infants.
And even if you do have an SSID, you still have to match it. That doesn't mean it's absolutely the same person.
But we just don't even have a process for that. And so, anyway.
I think that was a great point to bring up. Thank you. And I also just think that's partly why I thought today was going to be such a useful segue to start thinking about the role of the steering committee and thinking about larger governance issues. So having the conversation about hub data and then moving into having a conversation about the business case, I think will help us think more about that.
Okay, sorry.
No, thank you. So given the different types of metrics that we're trying to achieve, what we've been doing is we took those 10 metrics and broke them down. For example, the number of children served in a particular hub. What does that mean in terms of where this data is coming from? Which different programs are tracking this particular piece of data? And how do we calculate this for it to be meaningful to what we are trying to do? So we have this whole beautiful spreadsheet that says each metric is broken down into different data elements and where these data elements exist and how we can achieve integration with them. So the conceptual model is what we're calling a data mart type reporting structure. Folks who are familiar with business intelligence know that it conceptually is possible. But having that data mart created out of these various systems and the program information systems is going to be a challenge. And that is exactly why we are proposing a phased approach to achieving this. And the slides are a little misplaced, but this is the current thinking, where a reporting mechanism like that, version 1, is in place by June of 2014, that collects population or system level data. This is not collecting child level data at this point. And the flow of information is one way. What that means is information that already exists in these various departments is getting pushed into the data mart. And accountability and reporting happens at the system and population hub level. And then we move to the midterm solution, which we're calling version 2, which could be the same system, but it has expanded capabilities to collect child level data. And the goal is to have this in place by December 2014, where this has two-way communications between each system, where, by this time we are hoping that the hubs are in place, we have refined the metrics that we need to refine, and are ready for the hubs to start creating some information that only they can have access to. And then the long-term vision and the long-term version 3 is integration with the SLDS. And that is undefined just because we're working with the ODE on refining the timelines for the SLDS. And a lot of that will have to integrate with the work that Peter is doing.
So can I ask a quick
Please,
question? In
please.
version 2, what child level data would you be talking about? Do we know? I mean, that's just December 2014.
It is aggressive.
I
I'm
know
sorry.
what, do you have a plan on what kind of data that would be? What kind of child level data?
Very limited source.
Yeah, we've broken down what the desired child level elements would be, and they might not exist for every single program that's being coordinated, but we'd like to push ourselves to start to where child level data exists that can be aggregated and reported out at the hub level. We'd like to push ourselves to start doing that.
So you'd start with what exists already?
Mm-hmm.
Okay.
Yeah.
Exactly, and that's the other piece of work that we are doing that I mentioned earlier. And it's a work in progress where we're really getting into each data element to see what applies to us and where it exists.
So just so I can clarify, the one way is those agencies reporting to the hub so the hub can assess its progress.
Exactly.
Is two-way so that providers can share data among themselves? Is that what that's for? An example would be maybe a healthcare provider understanding more about an early learning educational opportunity that a child is in simultaneously. I'm just trying to understand what a two-way one might be.
Two-way, there are some data elements that only the hubs will be able to report on. So that's where the two-way comes in the picture, where the hubs will have the ability to create data sets on their own.
Right now, the state is pushing all of the information out, and we think on the system coordination metrics specifically that there are some things that we would want the hubs to probably report back to us, especially around reducing administrative overhead and the number of children that they're actually covering. That right now we can push it out, it's rough, it's population level, system level only. We think that we need to push ourselves to get to a place where the state is providing information to hubs that they're using, and hubs are providing information back to the state and aggregating it for themselves. That's also driving some decision making. And that is really important around the system coordination. part of their work specifically.
And specifically the cost. One of the metrics is cost per child. And only the hubs can provide that
Right.
information. So
Okay.
when they have the ability to give us that information, that's one example for two-way communication.
Thanks. So this is is there any discrete work that needs to be done to create version 1 that that isn't required to create version 2? In other words, are we having to do some work so that we can have version 1 that we wouldn't have to do if we just decided we want to go right to version 2? Does that make sense? Is there any discrete work? Is there any wasted work, basically, to create one version as opposed to the next version up the line?
I don't think there's any wasted work, Rob. Version 2 is going to build on version 1. So we're going to have version 1 ready, and if we are ready to collect child level data at that point, it then becomes version 2.
So as an example, version 1 would include from ODE, perhaps a list of the elementary schools.
Yes. Correct.
From QRIS might be the rating for the legal entities. From another, the child care, could be just a list of who are the child care providers.
That's what we mean by system level data.
So to use a really specific metric on the kindergarten assessment in version 1, we would see the kindergarten assessment data for the hub coverage area only. It's the system. It doesn't get down, aggregated, it doesn't get down any deeper than that. For the QRS, we would see the number of children in quality care settings, but just the number.
Right. So no identifiable.
Right.
Right.
So conceptually, you could have in year 1, after version 1 is up, by hub, some indicators at the kind of global level that might actually inform version 2.
Yes.
Because you would be, for the first time, stop me where I get this wrong, you would have at the first time cross-program data aggregated within a zone that could include some healthcare data, some child care data, some kindergarten readiness data, that at least would move the ball down the field from where we are right now. So in terms of expectations of constituents, that's progress. And I think part of the lesson we should learn from the events of the last 2 weeks is to under-promise and over-deliver. So to me, that would be progress, right? That you could look at a population by a hub and say, okay, and you could take the Children's First Children data book, which puts together some of that, parts of that stew too, and you can start making some assumptions. Maybe not, but at least you'd be looking at the data in a new way.
It would be much more informed than what we have currently, which is just guessing.
Yep. Yep. Okay.
But to your question, if I may.
Yes, please.
I just want to say that I think by fully scoping out what we want for 2.0, we make sure we're building on an electronic platform that can go that sophisticated for us, so that we don't build our house on sand and then have to take those requirements and build it somewhere else because we didn't choose the right kind of electronic platform. So we're hopefully trying to get all of those ducks in a row the right way, so that we are basically just having a de-scoped version of 2.0 initially, and then we're basically building up on that same platform.
So
you understand my question, right? I mean,
Right.
It's very clear.
Yeah.
Just would hate to, I don't want to spin any wheels on
Yeah.
something that isn't our end game.
We don't have the bandwidth to do that.
And I want to just underscore here, because we talked about this 3 years ago, but I need to keep bringing it to the table, is for the first Robert Wood Johnson grant for wraparound in Multnomah County, where we were trying to integrate across systems of care at the highest level of confidentiality, which is the healthcare system. We were able to create an interactive system that providers could use for $50,000. And so it was inelegant, it was imperfect, but it was affordable, and it was accurate, and it was people like me could use it. So I just want us to keep in mind that we have a lot of kind of graveyards of these processes that don't produce a usable tool at the provider level. And we have to keep in mind that the hubs have to be able to do that.
Yes.
So, okay.
Other reactions to this specifically, or should we move forward? We just go a little bit deeper in the next couple of slides.
My only other reaction is that the timeline seems really aggressive, and I wonder, the comment about promise and delivery, the comparison of the two. I would want to make sure that we're meeting timelines that we put out there for people to see, because it just impacts people's faith in the system when we don't.
It's a really good point.
I just want to make sure that we're not over-promising, unless there is some rationale about why we have to. I mean, is there a funding stream that says it needs to be done by, or is there something that's driving that timeline? And
It's the redesign of the system for all early learning systems. So, I mean, there's an urgency on the part of trying to get basically the roll up to kindergarten assessment and how we're doing. And there are outcomes to be measured with all these competitive applications. So it's important. I think if we look at every application that came in, looking at the early learning hubs, they talked about the fact that they needed help from the state in some kind of coordinated way to collect their outcomes that were meaningful. So, but I share your concern with a very aggressive term.
We may also decide, so I think the June 2014 is what we need to be looking at for 1.0, due to Jada's point, which is the system makes a full transition on July 1st. And we need to have a way to do the very basic kind of baselining and improvement strategy setting. After we see what the first round of hubs look like after the Early Learning Council meeting on November 12th, we can think about, is December 2014 really when 2.0 needs to come on? Is it staged out a little bit further? Certainly having more time for projects like this is always nice, but I think holding ourselves to pushing for that June 2014 date to have something operational is probably a necessity for the hubs to have what they need from the state to be successful.
But as we build out phase 2, I think that John's report is probably a very good example in terms of student outcomes or child outcomes being rolled into this system in some way, shape, or form, so that we wouldn't want them to be two separate systems. So just a thought that might help us in the stakeholder engagement or adoption process is after the hubs are identified in November, at the November meeting, it would be good to have hub representation on this work group to or in some work group to get them engaged in getting it going and working it out. Here's what's crazy and driving us crazy, and I always think that Apple, before they put stuff on all my stuff, should call me and say, how's it working, Lynn?
They don't do that, they call me.
Well, I want to get on that list, but I do think having our hublets engaged in the refinements and implementation would be helpful, because they'll see it from
part of the technical assistance. You're correct.
Yeah.
And that is an expectation between 1.0 and 2. We want to get hub feedback on how it's working and what needs to change.
Thank you.
Yeah, we've touched on most of these in the previous slides, but in version 2 we really need to get hub feedback, to your point, Lynn, and refine and tweak the metrics and the system in a way that makes more sense as we collect individual and aggregate data. So, I mean, the techies in this room know this by heart with implementation, and the reason we throw this up there is a little bit of education to people who haven't been involved in an implementation, is you really need to design the business processes, the requirements, the system architecture conceptually before you even go out and buy or build something. So we as a group understand this, and this is the process that we're going to be following to make sure that we implement the right thing within the right timelines. So on the technology side, we may make a build or buy decision, but on the business end is where we really need to come together and engage all the different entities to make sure we understand what processes we want to put in place, what the requirements are, which we've started, and change management happens at throughout the implementation. Because going from no system or no data collection to a really formalized sort of process and system can be tough on certain people. So we want to make sure change management is foremost in our approach here.
This is a context question, but a lot of states have created data warehouses where these data are being, from different agencies, are being stored and can be retrieved by people with the right authorization to do so. Is Oregon, is that a process we are involved in? I mean, I don't think that's your question. I think maybe it's some of the people in the room. Are we going to build it, or have we already started the design of a data warehouse for DHS, ODE, the different agencies?
Yeah, and I think the response I would give is there has been a movement at a national level for common education data set standards, and they reference the CED, the CEDS is the acronym they use. That's about as close, I think, to a common data structure as you're going to find from state to state. I
So
think,
we're not talking about...
Oregon is on the cusp of doing some really innovative stuff here. There probably are a few examples, but it's not rampant across the nation. I couldn't speak to where they are, what states have them. I believe Texas and Florida jump out as the...
Florida's got
Well, I think what you're asking is, are there common sets across the verticals, across human services, across education, across... And I don't know that there are. I think there's only within. Within education, I think there is common data. Within human services or public health, I think there's common set. But how they talk across that, I don't know of any common standards.
There are. The Florida, there's a couple that are
South
trying
Carolina, Wisconsin, there's a lot of states. That
No, but I mean at a national level that says everybody who uses this kind of data and this kind of data is going to adhere to this common data layer or this data.
Well, there's no need for example.
I mean, it's just, we're talking about a data mart, and I just wanted to be sure there wasn't another process going on in our state in which we were already talking about warehousing data in such a way that users could access from multiple agencies. And the answer, I think, is no.
Well, to some degree, it's the next agenda item.
Yes.
Oh,
It's
okay.
still a very open question. It's a great question. So,
It'll be part of the implementation.
Okay.
I mean, that has to happen for this to work.
Okay.
So we do know of, I know in Oregon Health Authority and Department of Human Services, that we do have.
We spent something like 7 years creating the integrated client services data warehouse, and that just takes data from all of our different programs within our two agencies and puts those together in one place. So,
And I wonder if there are
but I'm not
possibly
aware
other
of any
because we, especially for child welfare, when you have educational data coming in and health information, you end up with a lot of mixed data in there. But you would know better than I would what you have. But there are numerous efforts that have been going on to do this, and for the CCOs, and it's more of how much information is allowed to be shared, and there's other protections.
Yeah, and I know with our ICS that we've been reaching out to a couple of other agencies trying to, like corrections, we've been in discussions trying to get some of their data fed into ours and sharing some back and doing some of that. But I'm not aware of any statewide effort going on to take everything and put it in one place.
And then there's the other, I guess, just a note, a different type of model, which is what we're doing with health information exchange, where it doesn't necessarily all sit in one place, and that the standards create this ability to exchange data because it's in a trusted community, and you can share it back and forth when needed. And so the state isn't like the big brother in that model, and that's what we're doing. Different way of looking at it.
And I assume that we're working, I mean, that's why everybody's here. We're working to ensure that whatever we do for the hubs is aligned with these other efforts.
Exactly, that's why we wanted to get in front of this group so that we can put this thinking out here and kind of dialogue about how this fits with stuff that's already happening and make sure that we're thinking about it down the right path.
I think that's a good lead into the next slide where we say the hubs need to collect baseline data by December. And we need to report to the legislature in January. So an automated solution is not going to be ready by then. Because of all of those reasons, we have to make sure the data standards match up. We have to make sure the business processes and the requirements align before we can say we have 1.0 that can do this automatically. So one of the agenda items is discuss what the best approach is between December and when 1.0 goes on board to collect some of this data.
We're looking to the wisdom of the group to advise us on the right approach so that we don't do it in an uncoordinated or organizationally sloppy way.
This is probably not a very smart question, but just at the risk of. So I see two different things here. One that was called SLDS, the State Longitudinal Data System, and then another one that's called Data Mart. How are those two things, why do those two things have different names? How are those two things different? And the reason I ask is because my sense is that maybe one of them is easier to accomplish than the other. And as we're doing this, do we want to pick one method over the other because of its, neither of them are easy, but because of its ease? I mean, how do you, why are those different?
Because they are different. The SLDS is the statewide longitudinal data system that Peter's building a business case for, which we see as a larger piece that we need to fit into eventually. But in order for us to collect data from the hubs on the metrics that we have assigned them, we have to create our own data mart to collect the different pieces of information that make up our metrics. And then we can tie into the SLDS as the larger system to feed data into it.
So maybe just, it might be semantics, but a data mart is a type of data store that really connects to another set of databases. An SLDS is just, it's a longitudinal data system that we have on our K-12 kids. What Peter's going to talk about is going to be the P20 SLDS. So I think it's really nomenclature and how you use that terminology.
So am I hearing you say that in order to create the SLDS, we have to be able to mine data from the data mart?
I think that the conversation, that it may be getting a little bit fuzzy. So the way that I've explained it to myself as a very non-techie person is that we need to, in order for the hubs to report on how children in their coverage area are doing, and then to make subsequent decisions about improvement strategies, we have to aggregate data from a bunch of different sources, give it to them in a way that makes sense in a report. So what we're really talking about here is just data aggregation to go into a report that we can give to the field that allows them to start to do their work and then a way to aggregate that data again at some time interval to see if they're making progress. So data mart, it's kind of techie. Maybe it means different things to different people. What we're really talking about is a report of aggregated information at the system level and population level that lets us understand what's true for kids within hub coverage areas right now, and then look back and see what's true for them in 6 months, in a year, in 18 months, in 2 years. The longitudinal data system is different, but I'm probably not qualified to explain those differences. But what I just described is how I explained the hub need to myself as a person that doesn't speak data speak.
But I think, Bobby, you should be having PTSD because I know I am. So one of the challenges when this started 3 years ago was the kind of lack of clarity around the statewide longitudinal data system and what could get done now versus what it was going to take to get that system in place. And so I think the hope would be, and it's a really key point to integrate here right now at this level, is that whatever's planned for the statewide longitudinal data system would connect to the HubMart. But that the HubMart could get it up and going sooner and not have to wait for all the statewide longitudinal data system. The way we talked about it was this would be a component in the machine that could be easily plugged in and was not parallel and unrelated and couldn't connect. So we do need to put some time and effort into making sure that this is a component or one of the Lego pieces going to the greater statewide longitudinal data system. Now, the other thing that the hub piece needed to do, and this may be hard or conflict with the statewide longitudinal data system, and you have to tell us if that's true, is the hope was that so here's what we're trying to prevent. I'll start there and then we'll back in. I'm not a technology person, so Andrew, if he were here, could translate Andrew Grover, but since he couldn't be here. So what we do right now is we spend lots of money hoping good things happen, and we can't be sure that it does make good things happen. And so, for example, in the mental health system, 12 years ago, there was a child that we could track where the state had spent $3.5 million on one child who was still significantly failing on all metrics of normalcy or quality of life. And so what we're trying to do with the hubs is say, because of the governor's requirement, not only that we connect to the P through 20 system, but also that we drive better outcomes and serve more kids so that our numbers are much, much better than we think they currently are, we don't really know, is we were trying to create an agile data system where we could look at between P to 5, that certain interventions, if they occurred with the amount of money that we have or could attract to the system, could be more effective than what we're currently doing. And the example given was, if you gave every 2-year-old, it's hypothetical, but if you get, it's the reverse of the air conditioner model example. Really, we're doing all this stuff, but if we did if we gave the family a computer for their small children or an iPad or whatever, would that be as effective as all the other stuff we're doing? And I'm oversimplifying to make the case, but the hope was that we could get going on something prior to the elegance of the statewide longitudinal data system that would help us determine that certain investments could change the trajectory and increase results per kid beyond what we're currently doing, or in addition to what we're currently doing.
Wouldn't it be fair to say too that as our SLDS gets more robust and we add more functionality to it, the reports that come out of this data mart will also become more robust? This is like a reporting function for the SLDS objectives, and we can add more metrics as it becomes more fulfilled, because it is a long-term, trajectory for the SLDS to be built, but this just allows us to have visibility to how it continues to grow. Is that
it does.
help out?
Yeah, currently we don't have an elegant way of consuming early childhood data. This would be a good container that we could consume data from.
Right.
And for the purposes of the hubs, they don't necessarily need all data from OHA or all data from home visiting programs. They need select data sets for purposes of, to make use of. So it's really must-need data. It's not a full data dump.
Yep.
And I think that's a really important distinction.
And nor would they need to have all access
Nor would they
all
need
that
to,
data.
exactly.
This is just very specific, like almost like a,
And for
a
purposes
specific
of
audience
security.
would need specific information in order to make sure that they can make their efforts improve their
Yeah, that's right. That's right. So probably other data systems are needed for purposes of case management that go far and beyond what the hubs need.
Right.
But there are some select data pieces from your data system that you're building that are very relevant and useful for the hubs.
So I have a couple of questions, but if there are others. Sorry, go ahead, Lisa.
To me, an obvious parallel, and I'm assuming you've seen this, is that what OHA and DHS went through with the CCOs and collecting information and then having to give the information back to the CCOs parallels this exact scenario. And if you've sat down with their team to get information, lessons learned, what they would do in the future, I think that would be very helpful.
That's a perfect lead into my next question. So from where we are right now in this proposal to phase 1.0 being live in June, what are some of the obstacles and hurdles you guys see, and how can this group serve to help overcome them? And I think that's a really good example, and that's on the docket to meet with health analytics right now, to think about that and to learn from that.
That's a really helpful question. I can start and then Apache
go
can
ahead.
fill in. So we've gone through the process of looking at every metric that we've assigned to hubs to make improvement on, and actually like taken it down to what are the data elements that add up to this metric based on what we knew as a group, and we're validating our thoughts and assumptions on that with the actual owners of those data elements right now. So just continued support on connecting to the right people at OHA, DHS, and ODE as we're doing that evaluation. And gap analysis is really important. And then bigger than that is helping us figure out the right way to steer the ship forward as we finish making requirements for this, as we start to figure out what we want to procure. And as we know that we need to put together some kind of a report to the legislature soon, prior to any kind of anything being procured or any kind of actual automated solution, I think we just need to figure out the right people that we touch in each organization that help us get the information that we need, and we're not 100% sure the right business process for that, and so some advice and support on figuring that out from this group is really helpful. What would you add?
No, I think this group has been very helpful,
Yeah.
continuing to do so, because as you saw, there are many moving parts to this. So we keep sending out spreadsheets and forms, so just keep sending us back your feedback as you have been. We have a bunch of meetings lined up tomorrow to take this thing forward, and then I'm sure we'll have more questions and more fields to fill in, so your continued support will be appreciated. And like Megan said, when it comes time to do the market scan and make a build or buy decision, administratively the procurement support and just pushing this thing forward as fast as we can will be really, really helpful.
I'm also going to look at others who participated in the first data systems steering committee. So we spent a lot of time talking about governance structure and a steering committee, which we think this is, our goal was that this would fulfill to some degree the steering committee. Are we there? And what aren't we there with in terms of steering capability and governance? And maybe we should hold that thought for the after Peter's conversation.
Okay. I was going to say, I don't think we're there. I mean,
I don't have an answer. I just wanted to get feedback. So, what is missing, Bobby? From your
well,
perspective?
there's very clear descriptions of different levels of your governance structure, and I haven't heard us have that conversation about, I don't think this group per se, and we could be defined as that, but it might change the makeup of it. Anyway, I just feel like they may have already done the work of saying, this is the different levels of governance that we're going to have, and this is who needs to be in each. But and I am worried that we maybe aren't even giving enough time for the harmonization process. I mean, I've participated in one, and they take a couple of years. That's with people being willing to work really hard. So I do have some kinds of, just from my experience with similar kinds of activities, I do have some concerns is too strong a word. It's more how we're going to do it. I mean, it's not a concern. It's lack of clarity on something moving this fast. How are we going to be sure we put all these pieces in place and do the time-consuming processes well enough?
Absolutely. And we didn't present it in this slideshow, but we actually have a work plan that lists every activity that needs to happen. There's a methodology. So we just thought that was a little too detailed for this group, but we have that, and when we're ready to share, we will.
But Bobby, also to address your issue, when Peter presents, you'll also hear the P20 system, but for the Early Learning Council members, and I think from the first report to the second report, our life has changed considerably in terms of the fact that now you have a staff that also work with ODE, and we have the P20 system that also has the OEIB, and where does that fit? And so I think the governance issue actually should be more cloudy than it is clear at this point. So
But that's a healthy thing. Yeah, I think this isn't so much a concern as an answer to your question of the things that just seem needing to be more clear. And they may be totally clear to you.
No, they're not, but it's on the list. It's on the to-do list. We definitely need to have data governance, and not just data governance, process governance, and who does what and how often and who's in charge of what pieces. All of that we need to define, and that is going to be in our report that we put out.
Doug and then.
Okay, so just a brief comment, recommendation perhaps. Because of the recommendation or the fact that you're going to be putting student level data into this, I would actually have I would call out security protocols as a main bullet item. I think that if you don't have it out there front and center, it could be a disaster for us.
Sure, thank you.
So I don't know if this is helpful, and if it isn't, discard it. So don't do that. But, all the providers throughout the last 3 years have said, we do data track in some level or other. And I don't know if we've asked them to all send that in, but that would be a real helpful scan of kind of what is currently being collected. Like if you asked my organization, we could give you our data template and the frequency that we collect the data and all that. But even a very small provider can say, yep, we know, name, school district, ages, siblings, etc. And finding out what those templates look like right now, and that's just having them email them in, would be Head Start, Early Head Start, all of that, would be a really great way of getting a compendium of the architecture of the early learning system as it exists today. And that will help you know the scale that you're going to have to get to, or that we're going to have to get to. Because it's, some organizations are more sophisticated than others, some are more comprehensive than others, but they've all said we collect all this stuff, and we should start getting that pulled together.
Did you guys have other?
So just to wrap up, I guess my big question to the group is, are we on the right track? And can we continue to, and if yes, do we have the blessing to kind of continue to move forward to sort through all of the questions that are completely valid that were raised today, but to continue to move this forward through the agency and staff level channels that we've been working to try to address some of the data collection questions that we're up against pretty quick here. Any huge alarm bells? Yeah.
Forward with this plan?
Great. Thank you for engaging with this, and we look forward to continuing the conversation.
Thank you both. So we have our last important subject that I don't know which way would have been better to flip up. I think either way we should have come up.
Sounds like Peter should have gone before.
So if you need to step out at all or grab coffee, please do, but I think we should move forward and not keep people waiting on our agenda. So with that, Peter, I will let you take it from there.
Okay, everybody. Well, I'm going to be working off a handout that's labeled OEIB P through 20W Longitudinal State Database System. And one thing I want to call out just for everybody's knowledge is I'm 6 weeks into my job here, and when I first got here, I heard about P through 20. And in the legislation for the OEIB, that was called preschool through post-secondary. Not long after I was here, I heard that the P meant preschool and then prenatal, and that the 20 didn't just mean end of school, it meant the workforce. And so I just want to let you folks know that at least in the OEIB, and I wished I had changed this, but I already sent this to Seth, we're trying to adjust our language to be birth to college and career. And you may wonder why we're not saying prenatal, and I think it's because of some pushback in the field on state agencies saying things about prenatal. I don't know, but I know that OEIB, at least within our little group, we're talking about birth to college and career. So if there was a little acronym there, maybe it would be like B to C and C, but I know in different places where I go, P through 20 really seems to have caught on. And I know that we have like a cabinet that meets that's still called P through 20. But I think what we're all talking about with whatever acronym that we use is this continuum from very early in life or birth all the way through post-secondary and into college and careers. Exactly where it starts and ends, I think, could be the grist for hours of arguments that are not worth it, really, because you're trying to talk about everything in the middle. But I just want to mention that, and hopefully we can leave it to rest. I know, well, I'm just going to stop saying stuff on that, because every time this situation gets brought up or the conversation gets brought up, people get pretty fiery about the P or the 20 and what it means, and I'm not too attached to that. So when I arrived in this position, one of the first things I sought to do was understand what is the project, what's it talking about, and I like thinking about a set of all things out there. How do you break the set up logically into pieces so that the pieces span the whole set, but that they don't overlap? And since doing that work, I've done some work with Legislative Financial Office and DAS to sort of change that a little bit to say, what are the problems that need a solution? Because one thing I've been coached on is we don't want to come up with a bunch of solutions for which there's no real problem, because that leads to creep in scope that can really cause some trouble in terms of delivering on what you really need to deliver on. So actually this handout, although 1, 2, and 3 here lists solutions, really should be structured in terms of problems. And what I'm going to do is talk about 1, 2, and 3 problems and where they exist in this schematic. And my hope and my end outcome for this meeting is that we will agree on the 3 problems that I've articulated and sort of where they sit in this diagram. The actual solutions to these problems still are yet to be realized. That's part of the business case, is analyzing different alternatives to problems. And being a K-12 former principal, when I jumped into this, I jumped right to solutions. And I've been schooled up on the fact that I need to kind of back up a little bit, really articulate the problems, make sure I've voiced them correctly before jumping to solutions too quickly. So the first problem that sort of corresponds to number 1 is that we do not have at the OEIB or at the state level any real method to measure outcomes versus expenditures. Billions of dollars of stuff gets expended in our state, P through 20W, B through college and career, and yet our measures, especially for those who are appropriating these billions of dollars of funds at the legislative level, are not available. We don't have a way to actually tell you how we're doing towards 40-40-20 very accurately. And we certainly don't have a way to articulate whether or not money that's being spent in our system is moving the bar significantly. And there's a lot of elements to that. At the OEIB, we've just hired policy researchers, and they're going to be developing a policy research shop. But those folks don't have a data system that they can go to look at expenditures and outcomes. So that's a big problem as far as I'm concerned. It is the compelling problem, and I think the reason why this work is so critical is how do we justify the expenditures, the changes in governance, and all these different things that have happened if we really are not looking at outcomes systemically. In my little diagram, that policy level outcomes and expenditures issue is represented on the schematic as that thing that says OEIB policy database. It just as well could say legislative policy database or governor's policy database, but since that's the agency within which I work, we've labeled it OEIB policy database. The second problem that we have is that, and this is number 3 on the list here, not number 2, I'm sorry about that. We have a set of institutional databases in our state that do not talk to each other. To some degree, we've done work on that. The Early Learning Hub is paving the way for some work with DHS, DHA, and ODE and other institutions. But if you look in the box that I've drawn here, there are all kinds of institutional databases in our state that to some degree or another exist in a silo removed from other databases. And that is a big problem in terms of workload at the agency levels, in terms of communication. It thwarts certain efforts that we have, nascent efforts that we have at transitional points to measure student progress through transitions. And there have been efforts. ALDR is the #1 effort in our state currently that's attempting to embrace and get conforming agreements from preschool through post-secondary. And Doug can talk to you about this. I've been at meetings about the governance, the executive committee of ALDR. There's an intent to get systems to talk together. And to the extent that ODE can mandate certain things, they can accomplish that. But because there's no real governance agreements or data dictionaries that are common or big databases that contain all the data, the work of ALDR or the work of any bigger state longitudinal database is made much, much more difficult by the lack of standards. So I've put as a solution that we need to conform to new standards, but I really want to articulate the problem is siloed databases that don't have standard agreements and a lack of governance structure. The third problem, and this one might not seem as important, in my eyes as a career educator, it's the most important of all, is that we do not have a method that students and families can track their own achievement and either use that for their own planning or use it to manage transitions. So if you ask someone in a school system or at the ODE or at the college, do you have information about a student's progress? They'll say, yes, we do. We have a student record, we have a transcript, we have lots of information. But I got to tell you, if you go to the families or the kids out there and ask them, do you know where your child is? Are they college and career ready? Are they on track to graduate? Are they going to get a college degree? Most families will say, I don't know. I got a report card, I got some papers that were turned in 3rd grade, I've got some information about Head Start and this and that, but it's a jumble. And to the extent that you're privileged enough to really understand the trajectory from early learning to college, your family connects the dots. But to the extent that you don't have that experience in your family, or you don't really separate the signal from the noise, you're left with just a bunch of noise. And families out there have folders stuffed full of stuff that mean really nothing. And they don't inform the goal planning, they don't inform empowerment, and the term of art in my field is they don't make students and families agents in their own learning. They're at the effect of the agency, they're not driving it. And therefore, maybe a simple way to say it is students and parents don't know whether or not they're on track to 40-40-20. Huge percentage of them. And what's that the way that's been sort of represented in the diagram here is on the left-hand side as a personal educational record. Again, I've sort of jumped to the solution too quickly, but it encapsulates the idea that there is no personal educational record right now. And where that's really problematic is through transitions. We know that through transitions, we lose a lot of students. And on the ground, what happens is the student, when they go from agency A to B, can't really tell agency B, here's evidence of my learning. Here's what I've accomplished so far. Here's where I should be placed. Here's a work-study program that might be good, or here's an early learning opportunity I might need based on this. They just don't have that information. So those, and I've been to a number of meetings and talked with this with a lot of people, and I'm really looking forward to the opportunity for this group to think about, okay, what problems do I see with data? And do they fit within one of these 3 things? Policy level database about expenditures, institutional communication, and then student and family empowerment. Because I really want to know, as I'm writing this work, are there other problems out there that are not captured here? And second, is there one of these that folks here say, you know, this is not a big problem, Peter. I don't know why this is getting elevated into the business case. The big thing is 1 and 2. Number 3, not so important. And then I'll just say finally, then I'll just stop talking, is what's really been instructive for me being in the field is when you get to the state level, the complexities of governance and the complexities of agencies to some degree sitting under an umbrella, but not all the way under the umbrella. Like I think of DHA, where you're involved in early learning work. I've depicted that as part of a Venn diagram at the bottom here, but you're not governed by the OEIB. And early learning is part of the ODE. I mean, it's very complex. If I sought to draw out all the lines of governance on this, it would be very, very confusing. And I know that the intent of changing the governance structure in Oregon around education was to make it clearer lines of reporting. And I do think it's much clearer than it was 3 years ago, but it's still really complex. And I want to call out one thing I've learned from this meeting is even if everything on this page were accomplished, this doesn't span the set of all the agencies that are involved. And there's going to be a continuing issue of governance all the way through. And that's why I mentioned Florida. What was so interesting about Florida is it's in the governor's office. Social security numbers, birth certificate records, all the coin of the realm that allows SLDSs to really work sits at the governor's office. And in my eyes, the governor is the sponsor for this business case for that very reason. So in my box here, I have the ODE, Early Learning, and the Higher Education Coordinating Committee as being key players in the governance of this, but they're not the whole story, as evidenced by the different players that are at this table who are not represented by any of those. So I'm just going to stop and see if people can ask clarifying or probing questions or have some suggestions for me about what this is missing. And I'm happy to talk for the rest of the time about other aspects of this. But what's really critical for me is I've nailed the problem or not nailed it. So I'll stop. Doug.
I can't resist. So your first problem, I don't think relates to K-12. I may be wrong, but I would argue that we do have a database that will answer how well kids are going. I mean, basically what you're suggesting is what are the outcomes of kids and what supports were received and what types of kids were supported by those outcomes.
Right.
And I think the Quality Ed Commission and the Quality Ed model really was built to serve that purpose, to help the governor make those policy decisions about how much money is necessary. I can't say that's true. I don't know whether that's true in the higher ed. I'm pretty sure it isn't, or the early learning.
Well, there's a higher ed Quality Education Commission too. I'm a commissioner, just full disclosure. I'm a 4-year commissioner on the Quality Ed Commission. And we've got a model that's about 5 or 10 years old to recommend state funding based on that. And it's going to be revised. But it does call out something I didn't say. It's really, really critical that Doug said. All of these agencies have databases within them, and many of them are doing the responsible thing and tying outcomes to expenditures. So ODE is working on that. Community colleges do that. Universities do that. I'm sure that Head Start does that, I'm sure, to some degree. So when I say that we don't have one, we don't have one for 40-40-20. We don't have one about the statewide policy initiatives. We've got lots of little ones, and they're doing great work. Just like this early hub work is going to be very important and notify us how the hubs are doing. But, I mean, this will twist your noodle. What if positive work by the hubs in the long term is a net negative to 40-40-20?
Yeah, that's exactly the question.
Yeah, and just as one example, 3rd grade, reading by 3rd grade, and I was a former reading teacher, so don't get me wrong, I really believe in reading. But the consequence of more reading instruction K2 is less social studies instruction K2. And who's to say what effect that has on the dropout rate? We make this immediate assumption using correlation but not causation, because we see that more people in prison can't read. That if they'd have read in the 3rd grade, they wouldn't have gone to prison, based on no evidence whatsoever that that's really the causal link. It could be that there's all kinds of other underlying causes. And it could be that we keep people from going to prison by validating their culture, K2, as much as teaching them to read better. So that's why we need this larger data system to ask those larger kinds of questions. But yes, K-12 has got a lot of them. I mean, I think K-12 is a model in terms of outcome measures.
So I have given what this is, the term student longitudinal data system doesn't seem to describe it.
I don't disagree with that. And so let me describe one way it could and one way it might not. And lots of states are doing this, by the way. I've read like 45 of the SLDS proposals that have come into the states, from the states. If you imagine that all of the institutional databases in the big box are all going to dump all of their data every year, every month, or every day into the OEIB policy database, then you are creating an SLDS. And that data would, to a large degree, kind of mimic what Alder is doing right now, but at a little bit of a bigger level. Super Alder. Maybe you could just say Alder there. That's called an SLDS, or a data warehouse, and it's going to have all this data in it. Another way some states are doing it is they do a federated database model, which is kind of what you were referring to in terms of taking data out of the system only when you need it. And then the policy database is not replicating everything that's in all the institutions. It's querying all the institutions based on a set of standards that are adhering to. In which case the policy database would not be an SLDS. It would really be a set of rules about being able to query all of these different systems. And there's pros and cons to the two. Federated databases are cheaper. They're less responsive than building your own SLDS. Federated databases have fewer privacy concerns. They can be maintained by a smaller staff. SLDSs have, and there's a variety of them. And actually the federal government has come up with sort of, looking at how the states are doing it, the pros and cons of each of the two of them. And I'll just be honest with you, and this is something just to be completely clear. I mean, I was in a meeting with Doug 3 hours ago where we were talking about Project Alder and whether or not that system as it stands now is the prototype for an SLDS that needs to still be constructed, or whether or not it needs to be subsumed by a bigger database that's kind of P20. So there's a lot of open questions here about which alternative to pick. But I want to come back to my question, because you've done what I did. You jumped to kind of the solution. I want to make sure we've articulated the problem right, or the problems right. And if there's anything in this that doesn't articulate a problem that you folks have been hearing about that you really want to get on the table.
So one of the challenges on the early learning side of the equation is consistently reminding people that the function of the early learning system, in addition to other things it may need to achieve for healthcare, for education, for family reunification or unification, is to tie to the 40-40-20 goals. So in terms of have you identified the right problems? I think that first one, when you say we don't know what outcomes we're getting for the expenditures to get to 40-40-20, I absolutely agree. And what I need, or what I think the Early Learning Council is going to need from you is how do we make sure that connects to the hub process that we have going? And even if to the extent that what we just outlined here, if you see it not getting there in some organized fashion, then we need to get that out on the table and deal with it. The state databases don't talk to each other. You know, that problem costs a fortune every single year in real dollars, to say nothing of the costs on people who rely on the state to make their lives whole is huge. So if that one is accomplished or accomplishable, then that has merit and benefit far beyond just the OEIB, and it's so a huge, huge, huge problem. That's how we spend $3.5 million on one child who at 18 is headed for the state prison. That is what the current system produces. The third thing that don't have a method student and families can use to track progress, the part that probably isn't highlighted here but is huge, is that problem for families of resources gets solved.
Yep.
That problem for families without those resources absolutely doesn't get solved, and that problem for disabled or mentally ill or emotionally troubled children is magnified times 100. Because consistently those parents ask, why is it that my child just got through the GED, the high school, the whatever, and I know nothing about what he's going to do, he or she is going to do with the rest of their life now that they're emancipated and still have will have all the challenges they have. So, I think this is glaringly exciting in terms of defining a problem, and I think the challenge will be, and I think it's important to note, and it's probably the governor's office that can address this, there's real merit to getting these problem solutions in place, and the benefit will accrue to all the people in your box. And so if resources are needed from them, obviously they're here today, but this is worth a lot of intellectual resource, including if it's tied to 40-40-20, you have an opportunity to draw down significant private sector resources that are committed to that 40-40-20 goal. They've spent 10 years getting to the point where someone would adopt the 40-40-20 goals, and we should be sure to call on those resources to help you. But it seems really important in terms of what the hub's been trying to do. This was not in place 3 years ago when we were trying to build our engine. It was Alder, it was a little different than this. And your question about does Alder fit into a broader framework. So you need to help us on the early learning side, tell us, so we don't go down a bunny trail. Because ultimately our goal is the same as this.
You know, one thing that struck me when the early learning the hub's presentation was going on is in our office we're trying right now to do statistical modeling and analyses of the compacts and whether the metrics in the compacts are the right metrics. And one of the things we're accessing, I assume, is longitudinal data from ODE. And I don't know whether or not there's longitudinal historical data that's out there available on kids who've already matriculated through the system. Like I don't know how long Head Start's been keeping data, if at all. Not so much, just in terms of the modeling that we're doing about what we believe to be key metrics to look at pre-K. I just don't know if there have been repositories of data for years that have been collected and they're just sitting somewhere or not. That was the one thought I had, more about historical stuff than...
So my organization has the largest data set in the country, 20 years of data on a P through 18 population that has engagement in the child welfare system, the juvenile justice system, et cetera. So, and we have a researcher who leads our data. So if that can be just as a raw data set of help to you in any way, we've loaned it to other people. We're happy to loan it to you to support this effort. Anything.
Well, David Edwards then might contact you because that's what he's working on.
We're happy to help.
Okay.
I also see that being one of the opportunities with this discussion. I mean, the work moving forward is that institutional piece, that data, like for kindergarten readiness, as we talk about it as being not just an early learning or education strategy, but it really crosses health, human services, and education. But so once we can actually look at kindergarten readiness data and see those kids, for instance, if they were served by Medicaid for their first 6 lives, we can look back and see what happened to them or what services they got and see if any of those things actually support up their kindergarten readiness, or is the same on the human services side. But so part of the goal of getting there is to be able to do that. But to be able to model that right now, we can't do that because they're not connected. So I think keeping that in perspective too for one of the problems that we can solve.
So I'm going to follow up on that because I want to understand where this group is, because I'm coming on the heels of another effort to do this work at the OEIB. And the first document that I read about the SLDS had a list of expected outcomes that was as long as the longest list ever. And it promised every possible thing. And it was like the data mart in a sense. But it showed everything going into like a circle and everything coming out from the circle. So every agency would put stuff in, and every possible population could get stuff out. And so that's interesting, and maybe that's the right thing. And what it kind of looked to me like that the state was going to now do the job of all the agencies in terms of like reporting out information on how kids are doing or how hubs are doing or something like that. So just another way to think of it, what I heard in terms of the discussion here is that early learning is going to work on a system for the hubs to get data and then to report out data. And they're going to be the unique nexus of data from 3 different disconnected agencies who are then going to be able to come and say, here's what's going on in our local context. It makes a lot of sense to me. The people who are doing the work are closest to the data. Not a lot of worries about sharing data all over the place. It's kind of at the hub. The old proposal for the SLDS seemed to say, forget local data sets. Throw it all in one big bucket and then get it out. And maybe that's the right way to do it, but what it worries me is as systems get bigger, they tend to be less responsive to the consumer of the data, in my experience. And I don't know if you'll notice, but nowhere in this drawing does the OEIB database take away the institutional independence of the universities, the community colleges to do the work they need to do locally. It also wouldn't take away the hub's work. It would take from the hub critical data that would go to the policy database, but it leaves the hubs to do their work. It leaves ODE to do their work. So I just want to throw that out there. This is not a one-size-fits-all. Every parent in the state logs in and gets their data from this OEIB policy database. This would be for legislators, researchers. I don't know if that distinction is clear, but I want to say it because I want to see if people are thinking, no, that's what we are envisioning. Is that all the hubs would report to you and you report out to parents?
What's the process that prevents each of the data pools, Department of Human Services, OHA, Early Learning Council, all these, taking their data, reaching conclusions, formulating policy, spending money that is not connected with 40-40-20? You see what I'm saying? Is you have a disconnect because you're looking at isolated data set. Oh, reading is the most important thing not to go to jail. The Oregon, I think it's Kansas Health Authority just funded reading programs so that in their health money so that kids would not go to jail, because you do go to jail if you don't read. And my nephew didn't read by 3rd grade and he's not in jail. So, but how do you make sure that you're connecting the outcomes to the data and the decisions around the investments?
Yeah, that's such a great question. I wish I had a pithy answer for that. Because, I mean, right away you get to governance issues, it seems to me right away. I mean, you're going to have to do research to connect that data. And the research is going to have to be informed by longitudinal data sets that span many, many years. And either you agree that all that's going to get shared in one big database, or the leaders of these agencies come together and say that there's going to be sharing. I don't know. I think it's one of the most interesting parts of the process that's going to happen if this goes forward is answering that exact thing. So I don't have a good answer for exactly how that's going to happen.
I think you have articulated this very well. This is part of what we know as the governor's agenda, and truly the data is what's keeping us from being able to measure the investment. For example, we just left a meeting on pay for prevention, and some of the data that Lynn talked about has had to be used to be able to form how that moves forward, because there is nothing in Oregon that can address some of those issues. So I think from the early learning perspective, if you think about us with the Bridge to Healthcare and the commitment that we have, that Bruce Goldberg will talk about kindergarten readiness being one of his goals also, to the fact that we get to kindergarten and 3rd grade reading, those are kind of where we have to span, and we have to be dependent on those other systems to get there. So, but I think that what your posed question about what if hubs are a negative influence in terms of 40-40-20, we need to know that and change course correction. So
yeah, I mean, it seems silly. I'm just pointing
no,
out
but that,
we're making
I think
assumptions.
It's a very good assumption.
So other problems that, okay, go ahead, I'm sorry.
Sorry. Well, I mean, I think the problems, as I think about them and sitting here, these are the problems. What I don't know is I don't know all the data elements that are in Alder, because when I sit here and I think from my early learning perspective, which clearly is my perspective, I also just know when I think about the kids, you never know where a crisis happens in a child's life. And so I also wonder about the intersection with human services within Alder and some of that thinking. I mean, a family, a job loss, abuse, a death in the family, they might hit the DHS system at any point. And that obviously, there's a relationship for what their trajectory is moving forward. So I don't know if that's captured within Alder or what those connections might be as well. It almost feels like the Venn down in the early learning really goes across that entire child's life, potentially.
But the way we talked about it in the early learning system design and where we got hung up with Alder was, and Bobby, correct me if I've got this wrong, is there's the longitudinal data that you want to track, but there's also the client level data you want to track. And it seemed to us not impossible to take client level data and track it across all these systems. So you would know, for example, that a child had X number of things happen and entered the DHS system and was falling behind, and it's his or her tracking of academic performance in a way that was probably not going to reach 40-40-20. That didn't seem impossible to track at the client level if you use a unique identifier and you depersonalize, and that seemed the goal. That was definitely the goal of the hub stuff, was to be able to track at the client level multiple state investments from multiple systems of care to ensure that the child did not and the family did not fall off a cliff.
And that, Devin, if you want to answer, I don't know the answer to that. What Alder?
What's in there?
Oh, any provider or DHS data or anything like that, or?
Yeah, we don't have any DHS data in Alder. That's not been part of the scope. I mean, it could be built in there. It could be part of this system. Yeah, just.
But our goal wasn't to get the data in Alder. Right. The goal was to be able to have the identifier track across all the systems.
That's a bigger deal.
Yeah, identifiers are great.
That's a huge.
Which is why Florida did it. At
Actually,
the governor's
that's a
level.
problem in and of itself.
Right.
We don't have an identity resolution or identity management system.
And it's kind of like, is the identity, because I got interviewed before I even came up here when this was in the news. NPR did an article about the SLDS, and I had a quote in there that so many privacy advocates have now contacted me about, because I said something about an identifier and something about the state not needing person identifiable information, and that story's been, replicated and blah blah blah, and it is a big question. Is it a problem that we don't have one? Not necessarily. Maybe there's other ways to solve these without a universal identifier. So we have to make sure we really understand, is a universal identifier the only solution, or are there alternative solutions to it? Some states don't have a universal identifier, some do. Some assign it at birth. Some use Social Security number. Some states, though, issue any kind of ID number, and they do what marketers do. They make decisions about identity resolution. You're nodding because we talked about this on the phone. They do it at the moment. They don't, because it's like if my student ID number is 156, so it's possible that someday a number might get reversed and I might be 165. So any longitudinal database worth its salt double checks whether the identifiers really are the same person. Well, if you have to do that error check anyway, what's the value of the identifier? Well, it's a really good way to match data, but you're always going to be somewhat skeptical. Maybe it's 99% accurate. Marketers out there are tracking us without a universal identifier, but Google knows who we are. Lots of those marketers know who we are based on all this other information. And so some states are just not even using an identifier because the politics are terrible around it. I think the politics in Oregon are terrible around identifiers, and they're doing other things. So it's
The question that's just very unclear to me is, so there's longitudinal data to answer some some questions about outcomes that we have. And then there is information about supporting the child and family at a point in time. And I'm wondering if those aren't, I mean, to me, they're different. One needs to be very horizontal.
Yeah.
And the other, I think, can stay pretty narrow with only needed, very, very carefully identified pieces of information that are needed. And that's all that really has to be in to answer the outcome questions. But if you're going to be able to appropriately support a child, then this horizontal need, is it, anyway, I'm just wondering, is this really one data set that we're talking about?
That's why I drew it as 3 separate boxes. I see the problems independently. They're very related. Like, let's look on the personal educational record and imagine it anonymized. That is a longitudinal history of that student's progress through the system. So if you populate a personal educational record, and for the family, they can see the evidence of their accomplishments and where they went to school and what they did and what proficiencies they earned and what college they went to and what job they got. But you anonymize it, you have a longitudinal record of that student's progress through the system. So it's possible that that one could do double duty, but I drew them separately because I see them as separate. And I'm asking this group to be critical of it because I'm really interested in knowing and what I heard from Lynn is, yes, all of these are big problems, but I drew them separately because they're separate. And I asked our group here at OEIB, do we just want a snapshot in time? Do we really need an SLDS to do the OEIB work? Because all you want to know is how far we are towards 40-40-20 and whether people are hitting their achievement compacts. And then at first they said, oh yeah, we just need a snapshot, but the more they talked, they think they need a longitudinal database because they want to follow pathways. So, but I'm not 100% certain that even my team has really grokked exactly what they're talking about with this. So, yes.
Peter, one of the problems that I shared with you and when we had a different conversation, and I think this might be getting at what you're talking about, Bobby, is, and I don't really see it being a problem necessarily for this data system. I see it being a state problem, but not one that necessarily this is supposed to be the answer for, and that's the exchanging information across a care team for a given individual, particularly one that crosses multiple systems, so that we are most efficiently meeting the needs of an individual child, of course, in this early learning system. And I think, that's, Lynn, and you probably know more than I do about it, but thinking about the wraparound data system, that was exactly the goal. It also provided a longitude, it provided a policy, data set to look back on the return on investment of a wraparound system, but it also provided the team, crossing mental health, primary care a little bit, but education, human services, to share data on the individual families to best serve the needs of a very high-risk child. So that's not answerable through this system.
Right.
I'm not sure that it should be.
Right.
I think we should, but I think we've all acknowledged that along the way that that's a needed issue, especially when we think about hubs being the primary goal that they're coordinating for, they're a coordinator of resources for families. So I don't know what you think about that, Lynn.
Well, I mean, here's the having been in all parts of this process for 12 years, here's the conundrum we're in, is, 12 years ago, we as an organization did not integrate healthcare and education data, which to me, after 6 months of experience of that system, because the teachers did not get to know the healthcare stuff. They shouldn't, they couldn't, that was impossible. What that creates is a system that I thought the ACLU would be very interested in, because mentally ill children often have all of their educational outcomes entirely set aside because no one can talk to each other. And so the bar over the last 20 years for mentally ill people who may have, very exceptional IQs and competencies was set really, really low, because they just automatically assumed, well, all these behavioral issues, all this other stuff, we're not gonna look at. And so we found a way
probably in the 2004, 2005, to get enough information to go across education and healthcare and not have the HIPAA gods kill us, but that would enable mentally ill children to have quality educational outcomes. And then we started tracking those outcomes. And so it took a lot of work and it was really hard, but we did it years ago. It is possible through the system, the box you've got here, to create enough information getting to the right people to not violate rights, but violating rights goes both ways. I mean, underestimating children and families is a violation of their rights. And a lot of times these artificial barriers create, you know, pejorative thoughts about parents, when in fact parents can be trained to deal with difficult children, et cetera, et cetera. So to me, and I love your idea about maybe we don't need a unique identifier. Maybe we can ignore that whole problem by the way computers work nowadays and are happening on Google every day and Facebook. So I think what we want to look at is this little box up here, this OEIB policy database, needs enough information to drive to 40-40-20, but not too much to get in the weeds on, do we need to know what drugs mom was addicted to? No, we need to know if mom can be an effective parent, and there's a lot of data on whether mom can be an effective parent that doesn't say what drugs she was addicted to. So I think it's creating that is the challenge, and if we need to do it in a elegant 21st century way, 3 years ago we couldn't figure out how to get an operating system that drove a different result and have all be one big thing. I mean, we tried really hard. We sat in rooms for days and days and days. And there are other people not here today who had some role in that probably could inform what you're trying to do here.
Give me names, I'm trying to learn.
Well, David Mandel had very clear thoughts, and I didn't always agree with him, so but I'm happy to listen to anyone that'll get us to a solution for kids. And he's very smart. Andrew Grover is a resource to you. Couldn't be here today, but is a resource. Obviously, Bobby was there. And the world has changed dramatically since there. The guy who was doing Alder then,
Josh Klein.
Yeah, Joel. Was it Joel?
Josh.
I don't know where he is. He has.
Portland Public, right?
Yes.
He has some perspective on this. He was great at. I think he did yeoman's work, But I guess to me, I approach all these issues from the absolutely solvable, absolutely doable. All it takes is enough smart people in the room hammering at it hard and long. But I think we are very much in need of a system in this state that it's great if it produces longitudinal data. I'm all about the research, but it also needs to change the trajectory of what we're doing today.
So is that a fourth problem that's not really captured by set of institutional data? The fact that databases don't talk to each other, that's not a data issue, it's a privacy agreements need to know. Is that a fourth problem that we don't?
I think it's a governance issue.
Well, don't you think part of the problem, what I'm stuck with in this conversation is that you're asking me a question that I think gives us certain solutions. And my question, what I'm stuck with is, if I had a list of the different kinds of solutions that I could get to with the two different kinds of system that we're talking about, I might be able to give you a better answer. An SLDS could give you these kinds of answers. This other system could give you these kinds of answers. If I knew what kind of answers each could give me, I could probably give you an answer as to which I think we need. The other part that, so I've been sitting here struggling with the idea that one of the biggest challenges I think that we face at ODE is that somebody thinks of a piece of data that they want to know.
Yeah.
And then they ask the question. And as soon as you ask for a new piece of data, there are 15 new questions that you can come up with based on what it is that spits out. Because somebody says, well, what is this, tell us what the answer is to this, and we give it to them, and then they go, oh, I got 5 more questions now, or 15 more questions. And then pretty soon you have this huge, unwieldy system, and I don't always know that people are asking the right question. And then the other piece is there are so many people who can ask the question. So I can ask it to ask a question. But any individual legislator could write a bill and get it passed that could ask it to answer a question or multiple questions, and on down the line. And so as I think about that, I'd love it if we could design a system that said, here's who has access to determining what questions get asked. Not that that's very possible.
Really.
But at the same time, perhaps designing a system that simply won't answer some questions is not a terrible thing.
Yeah.
And then I go, but, wow, the world is changing so fast. And the way that we think about these things, how do I know that we won't need to ask that question, right? And I would hate to design a system then that doesn't have long stream upside, long-term upside, basically. So I'm just conflicted, but if I knew, back to my original statement, what answers each kind of system could deliver, then I would perhaps be better able to answer your question.
But I also think you can, to the point that their presentation made, is you can phase this. You have to have some discipline. Part of the reason we're in the mess we're in is because we didn't have enough discipline on producing results and holding us accountable to changing what's happening for kids and families. So I think we can say the first set of problems and solutions seems to me the one you identified. Are there more? You bet. Okay, but we have to get mutual agreement on the discipline to exercise a set of analysis that produces a result, or we'll still be talking about our 45% dropout rate when you and I are, in our rocking chairs on the front porch and 95 years old. So there has to be a time dimension to it and a discipline.
50, 60 years away now.
Yeah.
So for Peter to get agreement on all the stakeholders on what the actual problem is, allows him to perform an analysis that says, if this is the problem that everybody agrees on, this is what the scope of it is. This is what it'll do. This is what it won't do. Or these are the kinds of issues that it will address, and this is the kind of issues it won't address. Now what's the best way to do that? We originally thought it was this longitudinal database. That's one alternative. What does that look like against what we're doing now? What our policy priorities are, what the initiatives are. Okay, what does a longitudinal data system look like in solving this problem in some quantifiable means? What does a snapshot look like? What does a system with non-identifiable information look like? And let's rank those across the problem that we're trying to solve, the scope that it accomplishes that we've defined, and the cost, benefit, and risk of doing that. That's kind of the if that he's doing a so-that chain in his logic, so that any one of the stakeholders in here can trace back how we came at the problem, how we defined it, how we determined what was in scope, and what were the best alternatives for solving that problem.
But I get right back to the question that I asked earlier when we had the previous group up talking about, this is sort of phase 1, phase 2, phase 3, and that is, are we going to design a system that will get us to phase 1? But when we decide that we want phase 2, you have to go back to the very beginning and build a completely different system. And so that you don't have some kind of a straight line to your eventual outcome or possible eventualities. Because what we really need, and so it makes me think that what we really need is a very simplistic SLDS that will answer the questions that are before us today, the most basic questions that are before us today, and that's phase 1. And phase 2 then is what we begin to imagine as we move down the road, but where the work that's done in phase 1 is still relevant to the build for phase 2. And if what we end up with is something different than that is a dead end because we built it today, and doesn't answer the questions of tomorrow, that's really problematic as well.
But I think you have to be really clear, and you have to be really clear, is if this were not this topic, if this were a business or a project or any number of other things, you would say in phase 1, first of all, you'd communicate with your legislators who are going to add questions. You communicate with them at the front end. You do a presentation to all of them. This is what it looks like. Here's phase 1 of an SLDS or whatever you want to call it. There's a 20% risk factor that 20% of the questions we're asking we set aside in phase 2. You just call it out right. You identify the risk up front so people aren't freaked out when they see the downfall in the midst of the process, because no process is perfect. In phase 2, you'd say, okay, 20%, oh good news, only 15% was worthless. Now we're into phase 2 and we're going to get this far. But you also identify in terms of the percentage of risk, you identify if you keep complicating this and adding questions, the risk of never getting to 40-40-20 in anyone's lifetime in this room. I mean, you identify the up and downside risk in really simplistic ways, which you've done here, because I understand this, which means this means all the legislators would understand this. But you have to carry it to them at the front end, or they will keep moving the dial and saying, but what about this? And, oh, there's a new study. Kansas is buying books for their health program. Why don't we go there? So there's a discipline to it. There's a communication strategy to it. But the risk you identify right up front. You don't even assume it's going to be perfect. No one does. No one should.
So I want to acknowledge our time.
Yeah,
I don't want to butt into a really great conversation. I want to check in with Peter. I mean, what I hear was a lot of agreement on the 3 problems you proposed and a lot of clarity around the concept that is on this paper. Does anybody have any additions to that statement that you want to add?
In my email, you can just email me if something hits you later on.
Yeah.
Very open still at this point to more feedback.
Yeah. Anything else you needed?
No, it's been super, super interesting. Glad to be part of the group.
Thank you so much. I want to just take 2 minutes to pause and think about our second steering committee meeting. Any feedback for Rob and I about the steering committee, our agenda so far, how we envision this group working? I feel like it's going to be a little bit of a process, but I would love feedback.
So for me, it would be very helpful if presenters came, rather than just doing, here's an update, if there were recommendations that we were asked to act upon, or problems that you wanted us to solve.
Perfect.
Or that it just was informational.
Yeah.
Okay, I mean, we probably have 2 types of things. We don't know that we need recommendations on everything, but.
Yeah, that's true.
If we just clarify if it's informational versus
it's good to
needs
get the
recognition.
information now, but as we mature as a group moving forward, it seems that we should
have a decision.
We should have a different focus, and we should be acting on or making recommendations to take forward.
I think that's good.
Thanks. I think some of the informational process is expecting that there's decisions and recommendations to make as it gets more mature, but that's a great point to take. Thank you. Any other?
Do you want them framed in terms of this is what we'd like to see for a decision point from this group?
Yeah, that's helpful. And if we had reading materials in advance to help us kind of make our decision or base our thinking or something. Yeah. I found the information was very helpful that we received.
And bi-monthly meetings sound reasonable for the group? I'm going to try to not have 3-hour bi-monthly meetings, so I think efficiency and get our work done in 2 hours would be ideal. Okay, Rob, anything you wanted to add?
No, thanks.
Okay.
Great, very interesting today.
Thank you so much for being here.